I'd like to begin by acknowledging the traditional owners of the land in which we meet today. I would also like to pay my respects to the elders past and present. All right, welcome back to Project Life Podcast, where we talk all things life. If you're joining for the first time, I highly recommend you revisit some of our earlier episodes. You can subscribe to our YouTube, Spotify and iHeart streaming platforms and follow us on Instagram and TikTok. In today's episode, we are joined by an amazing woman who is a University of Sydney educated and trained speech pathologist. With 18 years experience in the profession, 12 of which have been running her own private practice. Specialising in paediatric caseloads, Kellie has a special interest in working in the field with students who have severe challenging behaviours and or mental health issues. Throughout Kellie's career journey, she juggles being a mother of 6 children. And in most recent years, the family have rallied together to support her 2.5-year-old son, Parker, through his diagnosis and treatment for congenital cataracts. Kellie Diamond, welcome to the podcast.
Thank you for having me.
I'm so looking forward to today's podcast. There's so much in there to really dissect and unwind. But I guess, first of all, let's start with your education and your career. Can you talk us through what it is that got you into the profession and how you got into that field?
Yeah, of course. I was always interested in working with children. Wasn't sure if I wanted to be a teacher, but was also really sporty, so thought I'd like to be a physio. So did lots of work experience at school trying to suss out what was going to be best for me. And after my prac as a physio in year 10, I realised that I couldn't do all of the jobs required by a physio, which involved beating people's backs to work up phlegm, things that I was like, I did not know a physio did that. I cannot do that. So I was really thrown and thought I was just going to be a sports physio, and then decided I might try one of the other allied health professions, and if I don't like it, at least I've got all the credits for the sciences that I loved, and then I could use them for something else. And so tried speech therapy thinking, yep, that sounds like kind of like teaching, but kind of like specialised, and then fell in love with it, and that's where it's led.
How good's that? So how long does the course take to study something like that?
It was 4 years.
Full-time?
And I did it over 4.5 full-time.
Okay,
when people say full-time for uni, I mean, this was full-time. It was not like a full-time course where I could work 2 days. And it was uni 8 to 5. I was a free person in a clinic working like 2 full days or a day and a half on prac, as well as doing like 7 to 8 subjects a semester. It wasn't what I hear full-time sounds like in other unis. There was no way I could do this with children, and there's no way I could do that holding down a full-time, like holding down a job, I don't think.
Yeah. Well, it does sound very full on.
It was, for sure. Yeah. And I remember at times wanting to quit, and thinking, this is so hard. And Mum was so supportive. She'd be like, just quit. If you really, really don't want to do it, you can quit. You've worked this hard to get this far. 6 more months. Just go 6 more months. And, and it was all worth it. But it was very, very challenging and had a really high AI at the time to get in. And I just got that UAI, but I always felt like you couldn't just scrape along in this course. You had to work really hard to do it. And I'm glad I stuck with it because I really love it.
That's amazing. And so you're a mum of 6. Let's just touch on how old are your children, and was it after uni you fell pregnant with your first, or was there a bit of time when you were in the career?
Well after, yeah. I went straight from school into uni. So did uni for 4.5 years. Then my husband now at the time, Tim, we met when I finished uni, or we started dating when I finished uni, and I'd worked in a community health setting for about 4.5 years before I had my first child. So I had a good chunk of experience under my belt with community health before I then had babies, and babies then prompted me into starting my private practice because I could choose my hours, choose my locations. I was sort of a bit bound in community health by the hours and the days you could work.
Yeah.
My own private practice meant that I could do that with children, which I think early in the piece was another reason why I wanted to choose this profession, because I knew that I could choose my clients, I could choose my hours, and it would be a really family-friendly career. So And it has been, definitely has been.
I've had these conversations with a couple of the guys at work when we do like career planning or like reviews at work, and I've sat down and it's like a list, like you've got to hit these milestones in your career before you have kids and you do this. And I just remember my project manager turning to me and it's like, now I get what my wife has been through because I've never had to think of any of these things. And you do, don't you? As a female, you think about these things. And since that conversation I've had with him, he's come up to me and he's had more females come up and go, I just had the same conversation with, blah, 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 and blah, blah, blah. And it's just like blowing his mind that we have to think so far ahead.
We really do. I didn't want to be left behind in my profession, but I also knew that I wanted to have a family. Always knew that. That was not, and same as Tim, we both didn't want to be old parents. And I say that cautiously because the age is slowly shifting that people do have children, but we both knew that we wanted to start younger.
Yeah.
I think we were 26 and 27 when we had Brielle, so she's 12. And then we've gone and had Fletcher, who's 10, Toby, who's 8. We had a beautiful angel, Lillian, who's not with us. She was stillborn at 21 weeks. And then we had Lachlan, who's 4.5, Parker, who's 2.5, and we've got Huxley, who's 3 months old. So we kept building that family. But definitely I wanted to get experience under my belt before we went into that whole mat leave, that shift into not being able to work full time. And, every time I'd have a child, I'd be really cautious that would take away from my private practice, and I'd have people who would be working for me in the private practice, but it's hard because schools really wanted my face back there and I'd be offering them a contract while I was away. So It's been a bit of a juggle, but it's 100% been worth it.
That's so good to hear. And you specialise in educating staff and parents around age-appropriate communication skills, and you advocate for services for these students that may need it. Are there any key indicators that those who are listening could look out for and identify as a potential reason to seek professional services like yours?
Absolutely. I am always advocating for people to, that just in case, put themselves on a wait list. We have great community services out there that offer free speech therapy to children below the age of 6. And they obviously have wait lists and that associated with them because they're free. But to have a 1-year-old who's not saying a couple of words, that's a red flag for me. I want my 1-year-olds to be saying 4 or 5 words by the time they're 1. I want us to have that expectation that our children will communicate with us and not just, leaving them be to have their own independent play without that engagement. Like I really want to know that my 2-year-old is coming to me and telling me things and I can understand half of what he's saying. And if I've got a 2-year-old who I'm not understanding, I want to refer them for speech too. So there are a few little markers for me, my babies who don't babble, my 1-year-olds who don't say 5 words, my 2-year-olds who you can't understand a thing they're saying or that aren't talking very much. That's really where it all starts, is right back then. And if we can pick them up then, it saves us so much more time when they hit school.
Yeah. I have a friend of mine, she's got 3 beautiful children and she was unable to breastfeed with, I think by the 3rd she just went straight for the bottle. But a few years later, when they started speaking, they had picked up that they had tongue ties and it has affected their speech and how they can talk. And it was quite shocked that they didn't pick that up in the hospital or have a look. Is that a common thing that you come across? Or
tongue ties are a very controversial area in the literature because there are bodies that think that it will cause speech sound issues. There are bodies that think that it's absolutely not, and unless you're severely affected by a tongue tie, it's not going to affect speech. In this case, if somebody can't breastfeed, that's quite a significant tie. That means that we're restricting all of the oral movement of our tongue. It indicates we can't suck swallow properly on a soft breast tissue. So we have to go to a bottle because they're longer, they're more rigid, and they're easier to suck with.
Yeah.
So there are key moments like that where you think, God, if that had been picked up earlier, that may have been something that could have affected their speech. But at the same time, there's other bodies of evidence that say they probably would have that regardless. Even if you have the tongue tie cut, you're still going to end up with speech sound disorders because maybe they were predisposed to that because genetically that's what they were going to have, or there's other factors why that might have happened. But I'm a big advocate for, picking those things up in hospital. and my little Parker would never have been picked up if a paediatrician didn't see him within 24 hours. I say never, like we may have noticed over time, but, you know, in the crucial moments of those first few weeks of development, being seen by a paediatrician within 24 hours and having that picked up early makes all the difference to his vision.
Yeah, that's amazing. And we will touch on that. We'll get to that shortly. But before we jump into Parker, is there any tips or exercises that you'd recommend for those to do at home? I know my son, you know, he's turning 16 months old and he is babbling a lot at me and he does say a few words, but is there any exercises or tips that I could do to help bring on his speech better or help him?
Absolutely. Just really, really important things that you hear all the time would be reading. Keep reading to them, and it's not because you want them to read, it's because you want to expose them to the vocabulary that you wouldn't typically say. So there'll be words in the book that you read to them that you're not going to be saying in your speech. So they absorb everything. You can lie when you read a book and they're not going to know any different. You can skip some of the words, you can change it all around, but the idea is that you've got a picture as a reference, as that triad of vision that little kids need. They need to have something that you commonly look at and that you come back together for. That's how we learn how to communicate and have a reference point to work out vocabulary. So they need to be able to do that, and a book is the perfect and most easiest companion to do that with.
Oh, I'm so glad I asked for books for his first birthday then.
Yeah, perfect. Pick off the list. So you can imagine the amount of books my household has. Yes. But it is the easiest way to expose them to vocab that you don't have to rely on a day-to-day basis to remember. Oh, I need to remember to show you that sound, or I need to remember that you hear this word. Because, you know, people will think, oh, I've never said that word to my kid. They don't know it. But it's not just going to be you. It's going to be the books, the TV they listen to, the game they watched on an iPad, the interactions they heard the neighbours having out the front. Every single bit of language around them, they soak in like a sponge. So talk, read books, and explain everything you're doing. That's really my biggest key tip and trick for anybody who has little people.
Yeah.
You feel like you regret it when they're 3 and 4 because they don't stop talking, but it is definitely the best thing you can do for their language.
My son, when he was younger, you know, I'd always read even when he couldn't understand anything. You just read the books to them. But now he's at an age where he can walk and run and climb, and trying to get him to sit still is a challenge. So what I've been doing is, you know, at dinner time when he's in his high chair, or at breakfast when he's in his high chair, I'll get a book out and he sits and he actually looks at it then. He's not distracted by, oh, look at that over there, and like bolting off over there or getting distracted by the cats or dogs.
So easy for them to do. And actually, not being a speech pathologist but being a mum, I worked out how inappropriate my book choices were for my daughter because I didn't know that she wasn't interested in that book that I thought she would be interested in. I'm reading her a book that might have 6 or 7 lines and she's little, and I know as a 4 or 5 month old they're just listening to it. But I slowly lost the interest, and I just never understood why she was not interested in my books. And it took me a while to go, my gosh, get your touch and feel books out, Kellie. Like, what would you do in therapy with little kids? Why are you reading all of these lines to her? She doesn't have the attention for that. Yeah. And I swapped all my books out, and slowly but surely I got her, and I got her good, and I'd repeat the book 14 days in a row. And my God, she loved it. And it was that repetition and that ease of language instead of the story. Because she was never going to understand the story, and I got that totally wrong with my own child when she was a baby.
We always are learning as parents, aren't we?
Absolutely.
Always. And you are a mother of 6. You're a working professional with your own practice and your own workforce that provide these services to school in Southwest Sydney. How do you juggle and manage your time?
I have amazing supports around me. I can't pretend like I do it myself because I don't. I could never go back to work if I didn't have a husband who worked from home on days, not because he can do anything in the day, but because he's here in the morning to help drop someone at school, or to help pick up a coffee, or to be here to do all the drops. But also my mum is amazing too. And when I have littles as little as Huxley, she looks at him on the days that I go back to work now. he's still breastfed, so she drives him over to me in the middle of my day and I feed him and then she drives him back.
Oh, what an angel.
Not because I'm being forced to go back to work. I just genuinely love it, and I love working with the students I work with. They're a really niche, hard caseload, and I want to be back and involved in their education journey and trying to keep them wanting to be at school and learning and identifying where they need help. So it's not hard for me to do that. And I do remember that feeling maybe before babies of, I'm going to have to do this every day. I'm going to have to get up and go back to work after mat leave. And Tim tells me constantly, my husband tells me how lucky I am that I do love my job, because he's like, you don't realise that a lot of people aren't in that position. They don't get up and, go, oh, I've got to work today. Like, you love going to work, and it's really great that you've found what you love. And I think that's probably how I juggle it all. The help that I have, the passion and love that I have for it, because I just don't think I could do it if I didn't.
It definitely helps you get up in the morning, doesn't it? And get going.
Yeah, and yeah, having everything planned, and things don't always go to plan, but having these set daycare days and these set preschool days, and knowing they're my only work days, and then not taking on any work outside of that, because I used to have a private practice at home, and a clinic where students would come through or kids would come through. And it was really my only time with my family on a Saturday. And then as the kids got bigger, we have Saturday sport and things that come up. So really restricting my work hours to only contract to schools and not have individual clients anymore, and only contracting to school-based services has helped me manage that caseload of having a family, having a work-life balance, and then being able to do what I love.
Yeah, being disciplined in what you do. Yeah. I feel like I'm becoming a lot better at project management being a mum. Yeah. Like when I went back to work, one of the first things I had to do was do a review. And that project manager I was talking about before, he's like, I really am interested to see what you write down from your mat leave. And I was like, oh, I didn't even think about that. I was thinking about the 6 months before. And I'm trying to think about what did I do that long ago. Mm-hmm. And one of the things was, time management, project management, running the household, running the family, scheduling everything, like managing the whole lot, and at the same time building a house and doing little bits and pieces to keep my mind active, because I love going to work, because it, just gets your mind going. It really does. Yeah, it definitely helps when you like what you do.
I do talk to kids all day, so the hardest bit is that I don't walk away from little people conversations or kid conversations, and I don't walk into like a workplace with a lot of adults. I do have colleagues, but I really am face-to-face with kids all day too. So I guess maybe I'd feel a little bit more like it was more of a break for me maybe if I had less client interaction, but it is what I love doing, and I don't walk away and get to go to an adult conversation office. I go back to having more conversations with kids all day long. But maybe they are a bit older and from a completely different walk of life. So I do enjoy that.
And you'll have so many different personalities. It will just be like what you're feeling. Oh, this one's a bit too full on today. Dad can deal with them. I'll go to this calm one over here.
and these two get along today, but then tomorrow these two get along.
Yes. And so let's talk about your son Parker now. So he's had some challenges medically, and when did that all come to light? And can you talk us through what exactly it is and what's happened since the diagnosis?
Yep, absolutely. He was born in COVID, so typical. Everything was fine. We wouldn't have thought anything otherwise. That nothing's ever picked up for. I mean, nothing. In terms of cataracts, we would not be looking in eyes. In my 20-week morphology scan, they don't, unless you were missing an eyeball, they very rarely pick up something wrong with the lens in your eye. So we just had him. Everything was peaches. And then with that first paediatrician check, he came in, and it's something I'd never paid any attention to was when the paediatrician lifts their eyelid up and flicks a torch over their eye, and they do it to both eyes, and they don't mention anything and they walk away, and even the GP does it. Like, I'd not really paid attention to what that was. So he's looking for a red light reflex in his eye, and obviously he flashes the light over his eye, and you expect to have that red light flash back like a cat in a photo, or sometimes in our older photos you'd see it.
Yeah, I get that.
And he was holding Parker in his arms, and he's saying, oh, and I didn't really notice, but he kept doing it and he kept doing it. And then he walked him into my ensuite in the hospital. So I had a private room and I had my own bathroom, and he walked him into the bathroom, turned the lights off. And I'm thinking, what is he doing? And he was flicking his eyes with this little torch. And he come out and he said to me, look, I can't seem to get his red reflex in his eye. And I was like, oh, okay, what does that mean? And he said, well, it means that I can't see the back of his eye, like where the light should get in to allow him to be able to see.
Right.
I need to be able to see that lens. I was like, oh, okay, so what does that mean? Like, I was really oblivious, never had eye issues in the family, not familiar with it at all. And he said to me, look, let's not jump to conclusions. I don't really know. Sometimes I just can't get it and I miss it. But what I'm going to do is call in a specialist ophthalmologist, and I'm going to get him to look at his eyes. Because without his opinion, like he said, look, 19 out of 20 times I'm wrong and I can't get the red reflex, but I just can't see it in his eye. So I say, okay, all right. Obviously he leaves. I jump on Google, the worst thing you can ever do, because I'm reading about optio, tumours and all these horrendous things that can happen to babies' eyes.
Yep.
So I'm reading thinking, oh my God, he's going to have to go through chemotherapy. What's going on with his eye? No, surely it's just a mistake. It's a mistake. So then the most beautiful doctor, Dr. Stephen Hing, who was the head of Westmead Children's Ophthalmology, who has retired from that position but has a private practice in Hurstville, right next to my hospital, right where I am, could not have been more meant to be, comes in less than 24 hours again after that and comes to see me. And we're obviously super anxious thinking what's going on. He puts drops in his eyes, was absolutely beautiful, and said, they're dilating drops. They'll open up his pupil so I can see inside there. I'll be back in 40 minutes. So 40 minutes go by. Tim and I are sitting there, a nervous wreck, thinking, okay, all right. Actually, I was on the phone to Tim. Tim wasn't there. I was by myself. And so he's gone. He's come back, and brand new baby flicks his eyes and says to me, no, I really thought you were going to be one of those 19 in 20, but you're actually the 1 in 20.
Oh, wow.
He has a congenital cataract. And
one
again,
or
not knowing
two eyes? One or two?
Just one eye.
Okay.
So he said to me, that means that no light gets into his eye, and it's treated like a medical emergency, because if we don't get his milky lens out, he won't ever be able to see out of that eye. So I'm like, what is going on? So, you think of cataracts as older people, and it's an easy surgery. They go take their lens out, replace it with an artificial lens, and walk out being able to see. Completely different story for a baby, because they've never ever had light hit their retina in their eye. The optic nerve's never turned on before, so he actually doesn't know how to see out of that eye yet. And at the moment, he's not able to, because no light can ever come in his eye. So he gets us to look in his eyes and says, I'll show you what I'm looking at. And one of his pupils is black, and in his right eye, his pupil is absolutely like a cloudy white milky colour. So I think maybe over time, Tim and I would have noticed.
Yeah.
But as soon as he pointed it out, we were like, oh, okay. He said it's not a mild cataract, it's a moderate to severe cataract, which means no light's coming in at all, which means we need to get that out. So here's a number. Call the Children's Hospital. I know this process well because I've worked there for however many years, and I was the head, and now I've handed it over to Dr. Michael Jones, and he'll do the surgery, and our heads are spinning, and we're like, what do you mean? What's going on? So, we pretty much leave hospital and we're home for 2 days, and we have this appointment at 1 week of age to go and have an ultrasound on Parker's eye to confirm that he does have a cataract and to see what his eye looks like. And, we go back over to Tim can't come in with me because it's COVID, so I'm by myself again, and I go in with Parker, and I'm waddling in feeling all emotional because I'd only had a baby a week ago. So I think I cried at the drop of a hat for anything that week.
Yeah, I know that feeling.
They confirmed that, he does have a congenital cataract. They looked at the origin of the cataract because it can be genetic or it can be a sporadic development in utero. And he had a certain type of cataract that was not genetic, and it was an acronym of 4 letters, like a PPRP cataract or something, which meant completely sporadic, happens during development, no known origin. So that was wonderful news, because it meant that, if we ever had other kids or wasn't something that had come from us, it was just literally in development it happened. but he was booked in for surgery at 5 weeks of age to remove his cataract. Removing his cataract meant that his entire lens comes out of his eye. So his right eye has his lens taken out, and they don't replace the lens till he's older because his eye is too small. So then we've spent the last 2 years using a contact lens on Parker's little eye to help him see, as a bit of an artificial lens for him.
Yeah.
Until November, when he finally had his surgery, to have an artificial lens put back in his eye.
Oh, amazing.
And I say that 2 years like it went quickly, but it was a long haul of keeping a patch on a tiny little baby who swallows them in a heartbeat and then throws them when they get bigger. And, we had a lot of people helping us do this patching because it was hard work. And we've got another 10 years to go. But having him over an age now where he's not going to put a patch into his mouth and swallow it is a much better age than what we had when he was sort of 4 and 5 months old patching. So
yeah, it would have been a process.
It's been really positive in terms of his vision changes, but that's because we were able to get in so quickly, have the lens removed. We got brilliant doctors at the Westmead Children's Hospital that we've been regularly seeing. They update his contact lens all the time, and Tim and I learnt how to do that for Parker for 2 years. And then when he had his surgery last November, they've now put the artificial lens in. So he just has a gorgeous little pair of glasses now and continues patching his other eye to keep strengthening it. So
how long does he have to do the patch for? So it's just to strengthen it now. It's not to protect the eye or anything.
He keeps wearing the patch on his good eye. So it's never, ever been on his cataract eye.
Right.
It's always on his... And it's funny that everybody who sees him would assume that that's his cataract eye and that he needs it patched. But we've always had to patch his perfect vision eye, which I struggled with initially because I was like, we're going to damage his vision? Like, that's his only good eye. He said, no, that eye's too good. We have to cover it. Or his brain, from a very early age, will say, that eye's useless. We're not going to use it. And it will wander off and go skew-if, and his other eye will do all the work.
Yeah,
so
right.
we've always had to patch 50% of his day that he was awake. So, again, juggling that when he was little was a lot harder because I'd be like, oh, my God, he's been asleep for 3 hours, or I know he's going to sleep 2 hours this afternoon and I need to get in 4 more hours this afternoon. Now it's a bit easier because we just put it on at 8 o'clock in the morning, take it off about 4 o'clock in the afternoon, and we know that he has on either side of that of unpatched vision, and he'll keep doing it till he's about 12.
12. And now that he's got that lens in, is that it? He doesn't need to have any more surgeries or anything?
Well, he may need to have another lens replaced when he's 12, depends on how his hormones change. If his hormones shift and the lens, he sort of outdoes the lens, it can happen. We don't know if it will, but we're just going to be watching his vision journey over the next few years, and that might be a possibility. And then as an adult, there's also a possibility that he could go in and have a stronger lens put in if he needed it, or a weaker lens put in if he needed it.
Is that as he gets older and, we've got all these screens now, your eyes aren't as good?
And I thought it was to do with how good his vision was, but it's actually more technically to do with the shape of his eye and the measurements of his eye and how light refracts from that lens.
Right.
So I thought it was all to do with, how good his vision has got, and then we'll put this lens in because that's going to work best for him.
Yeah.
But it's absolutely to do with that. Apparently it's more to do with millimeters and diameters and curvature of his eyeball. And there's some fancy technical, script that they use for it in the hospital. Yeah. And only the ophthalmologist knows how to do it. And we actually got our surgery delayed twice because when they went to put his lens in, they didn't have the right one for him. Right. So hopefully he doesn't have to have another one, but if he does, it will be for a good reason to get a better lens put in.
And how often did you have to go back to the hospital for them to reassess?
We went back every 10 to 12 weeks to have his contact lens changed. Yeah. Not changed in terms of in and out of his eye, changed in prescription. So there's a special place in Western Australia that makes little babies' gel lenses. So your typical contact lens comes in and out every day, but that's not practical with a little baby because their eye will get too infected and too dry. So they make these 80% gel water lenses that he can keep in for 7 days. So we'd put it in on like a Sunday, and then we'd take it out on a Sunday night, clean it, and it'd go back in the next morning. And then we'd go back to the hospital every 12 weeks and they would look at his vision amazingly without him being able to say a word. They could look and see what his eye could focus on and how what his prescription needed to be. So we watched his prescription drop from a plus 26 all the way down to a plus 12.5 before he had his surgery.
And that means that the patch was working. It was strengthening that eye.
Patch was working. They were just amazed that this little kid was keeping his patch on. They
Early
only have a couple of kids each year that come through the clinic with cataracts. So we're a bit of like a royalty when we go in there because, you know, there's only 2 or so that come in. They all know Parker. And there's plenty of eye conditions that go through the Westmead Children's Hospital, but obviously cataracts are they're about 1 in 10,000 kids. So
incredible.
And that's even, you know, in New South Wales, she said on average they get about 2 a year. Yeah, there was us. There was another little boy there who I knew was a cataract. There was actually another little girl who had the bilateral cataract, so she had both, which for them, Mum was really happy with that because it meant she didn't have to patch.
I was going to say, like, what would you do? Would you have to change them all the time?
Yeah, her contact lenses were the same. She had both on. She wore them all the time, and it was just like practicing normal vision. Whereas the tricky thing with one is that if we ignore that eye, it's just going to wander in and he'll never be able to see out of it. So
yeah,
it was. I still remember this ophthalmologist, Dr. Stephen Hing, who came in and he said to me, "I am so glad that you have 5 kids." And I said, "What? Why? That sounds so odd because I've got to create so much time for this little child now, like, you know."
Yeah.
And he said, "No, you won't worry when he cries because kids cry when they get patched and you'll be okay with him crying. And you'll know that kids cry and they don't like things, but other parents will be like, oh, it must be the patch, we've got to take it off." And he said, "You've got more experience with how often a child cries." So for me, I'm really happy. The best family he could have been born into was one that has all of this action happening and all of these people for him to focus on, all of these distractions when he's patching, and somebody who is okay with a baby who might cry.
Yeah,
and I didn't really cry at all, but it was, I'd still remember him being the most positive, amazing ophthalmologist and the best first interaction I ever had for the news that we sort of weren't expecting to get.
Yeah, it's such a crazy story, and to just be that really niche little medical condition that comes through the doors, and it was your little Parker.
And people had heard of cataracts, but everybody that goes, a cataract on his eye, he's a baby. I was like, I know, it's an old person condition, isn't it? That's what I, as immature younger person and not knowledgeable on cataracts, was just like, I thought it only happened to older people. And it was just something that slowly grew over your eye and then you went and got it fixed. But no, this was just a little glitch in his development that happened, and we're just so lucky that nothing came with it, because typically cataracts come with syndromes or come with medical conditions, and he's one of those very few that just have a congenital cataract of unknown origin, which for him meant that it didn't come alongside anything else, which was so great.
And what has been the biggest challenges you guys have faced as a parent and as a family through this whole process?
I wouldn't even say it's the appointments, because, you know, he quite enjoys that day out, and the parking at Westmead is a punish, so maybe that's it. But it's probably the mental load I put on myself. And, like, as a family, they've been amazing because everybody gets to pitch in and help and give a bit of respite when he needs a distraction when he's patching. His daycare is amazing. I feel like they give me respite too, because he patches for 2 solid days there. Like, he patches every day. But if something's happening, like, I get that guilt, I guess, that, like, well, today he hasn't kept his patch on well enough, or we're very good at keeping it on, but, you know, all night he's ripped it off all day, or, you know, we've been in the car for, 4 hours today because we've got lots of kids and we've driven to this sport and that sport, and it's physically impossible for me to keep a patch on this child when we're driving, because as soon as he's bored, what happens? Rip it off. So I guess as a family, it's been, negotiating where we go, when we can patch, who can help. And I just feel like with all the distractions in our family, we've worked out what works best for little Parker, and it is being busy. As hard as that sounds, to stay busy all the time, the busier we are, the more distracted he is, and the easier it is to keep his patch on. And all of a sudden we're 4 hours, 5 hours deep, and I'm like, yes, look how much patching we've got done today. Maybe the amount of patches we have to buy, the physical waste of patches is amazing.
And the
cost of
constant
patches
thought of
are-
it. I feel like it's constantly on your mind, just how you were describing that then, just constantly thinking about a patch.
It is. All I think about is a patch and his contact lens and what his eye looks like. So as a baby, keeping a little contact lens in his eye, a bit of sand gets in his eye, damaged the eye. Back to the children's hospital, scratched cornea, new contact lens comes out, he can't see out of that eye anymore, and I have that stress that his eye's not going to be working, it's not going to be challenging itself, it's not going to be developing those muscles. And everyone would assure me he's doing fine, he's doing great, but I know it's because everybody around us was putting in effort. It wasn't just luck that he's seeing out of that eye. It's because we would persist with patching, and I had so many people to help me persist.
You're very
He's
lucky.
got sister dancing in front of him, a brother, distracting him. I've got this person going, "Oh, Mummy's eating his patch," or "Parker, where's your patch?" So,
very lucky to have a big family and a big support network around you. I have to say, to have gone through that and just that mental load, like you said, taking that on. Now, we are running a little bit out of time, so I am going to say a quick thank you for everything you've shared with us today. The story is so unique and so special, and having seen those photos myself of little Parker wearing his patch, absolutely adorable. But before we let you go, I have one question.
Yes.
Did you have a pirate party?
We had the best pirate party, and we made everybody wear a patch because it's only fair, because it's Parker's first birthday.
Yes.
So he had a pirate themed first birthday party where everybody in our family was expected to wear a patch, and nobody could last more than 30 seconds with a patch on because we got both sick. It was horrible. The appreciation that everybody had for this child all day was next level. So, yes, we've got all of us. We all had decked out pirate outfits. Tim was Pirates of the Caribbean. All the kids were pirates. Everybody became were pirates. It was so fun.
I need photos of that to share with these listeners of this pirate party. So I love that. Thank you so much. And thank you for sharing about your career and your journey in speech pathology as well, and everything that you do for the community there. It was lovely to have you on.
Thank you for having me. It was a passion of mine, and I love talking.
Thank you for joining us for this episode of Project Life Podcast. Do not forget to subscribe to the YouTube channel, follow us on Instagram and TikTok, and subscribe or follow on any of the listening platforms where you stream your podcasts.